Hey everyone, so we are bringing you another episode of Ask the Expert today, and we have Dr. Katherine from Birth & Co. with us, and she's going to share some information about chiropractic. So chiropractic, I don't want to say service, but like, what would you say in that example?
Yeah, I think that services is appropriate. There's kind of some different areas of chiropractic. Like we do prenatal in my office, and we do a lot of pediatric and a lot of postnatal. So those are kind of our niches. But yeah, I would say that we have services that we offer people.
Awesome. Perfect. So tell us a little bit about you. So tell us sort of where you're from, how you got to this place that you're at right now and owning a couple of different facilities of what you do in your business. So tell us about your journey to get where you are.
Yeah, absolutely. I am going to condense my story because it's very, very long. But I was introduced to chiropractic when I was about 10 years old. And it wasn't because I went to the chiropractor, but it was actually because I had a younger brother who was 3 at the time, and he started having seizures. And so my parents did what every amazing parent would do and took him to all the medical specialists within 3 states, and no one could figure out what was going on. He went from 1 seizure to 21, I think was the most that he had during a day. They were full grand mal. He was non-functional. And the best hope they got was, here's some medications. He might grow out of it. And so my parents started looking for alternative things that they could do. And we had a family friend that was a chiropractor, and she said, chiropractic's not going to hurt. Why not bring him in? It'll help his system to regulate, if anything. And so my mom took him there, and the first time he got adjusted, the next day he had one less seizure than he had been having. So over the next 6 months, that chiropractor worked with my brother, and he was able to stop having seizures. He got off all his medications. She worked through adjusting and through nutritional changes and some detoxing, and just took a really holistic approach to getting his body regulated. And so for me, as a middle-aged child, I had no idea what chiropractic was, but I was like, I would like to do that for families because it was life-changing for our family. So I Thank you. Yeah, it's a little bit different. People think of chiropractic for like back pain and headaches, which it is great for, but just general regulation and promoting the body's natural healing process is another aspect of what we do as a chiropractor. So, fast track, I'm in chiropractic college. I'm going to do pediatric. I love doing kids. And it turns out not a lot of moms want students practicing on their kids. So it was mostly prenatal patients. And it was in that moment that I really connected that kids' health really starts in utero and with the birthing process. And if I could impact mom and help promote having a healthy, safe birthing process, then I could get the kids' health better early on versus treating them for birth trauma later on. So I got really into prenatal care. And then when COVID started, I noticed that a lot of my moms were not going to get their postnatal care. They weren't going to pelvic floor PT. They were trying to condense and do it as few appointments as possible. And so during that time, I developed our postnatal programs, which are our core and pelvic floor rehabilitation programs. And so around the time of COVID, the office that I have now is called Birth Co., and it offers chiropractic and rehab and massage and functional nutrition and hormone testing. So we kind of have all these aspects of holistic healthcare in one office, which I love, love, love. And it's in a family friendly environment. So you can bring your kids to all of your appointments, which has been helpful for a lot of our patients.
Oh, 100%. I mean, when you are a new mom, you're like, well, if I don't have a babysitter on hand or family or a nanny, what am I supposed to do? But I would imagine that is so helpful because then everyone has no excuse not to come.
Yeah. And I'm always shocked. I don't know. It's like you have a baby and they hand you the baby and they're like, good luck. And you don't have like a prescribed place to go make sure that you're healing up or doing rehab where you can, I don't know what you're supposed to do with a baby. Not everyone has someone that they can just give baby to for an hour so that they can go get their body worked on.
Tell me a little bit because I'm a chiropractic virgin over here. So tell us, and my kids are teenagers, and I feel like at the time when I had kids, there was I mean, and I was in downtown Chicago, you'd think there'd be like all these options, but I didn't know a lot about this at all at the time. So tell us a little bit about the expectant mom. So what do you, if a typical expectant mom came in and said, hey, I'm feeling some kind of pain, or I'm going through this, or I'm going through that, what are the common struggles for an expectant mom? And then how do you work on that patient with whatever she's looking for?
Yeah, absolutely. So the most common things that we see in our prenatal patients are low back pain, sciatic pain, pubic bone pain. Really, most people come in with some sort of pelvic pain issue. We also have a few patients that will come in because their upper back is hurting them and their posture is in a weird place because they're adjusting to the growing belly.
Well, and their boobs are big. So like that's a whole situation too.
Yeah, especially the first time moms, because no one tells you your body's going to change in these like crazy ways. I mean, you're going to grow a belly, but it is so much more than that. And so, as a chiropractor, there's a couple of different things that we're doing to make sure that your body is adapting comfortably. The technique that we use during pregnancy is actually called the Webster technique. And Webster technique at its most basic form means alignment of the bony pelvis. So the pelvis where we want baby to be able to come out of if we're having a vaginal birth, and release of the soft tissue that's attached to the bony pelvis. And research has shown that being adjusted during pregnancies can make your labor shorter and less painful. And that makes a lot of sense. If everything is balanced out, then your body can open up the way we want it to without getting caught or being twisted in any sort of way. And we also want to make sure that we're creating a lot of space for baby to get in the most optimal position. We find a lot of times if there's a lot of torquing in the pelvis, patients will come up to us and their babies will be breech or will be transverse. And so a lot of times there's some biomechanical structural issues that can prevent baby from being in the right position for birth.
How awesome that you could get adjusted, and especially breech, where you're like, all right, we got to move things around a little, and then the baby has room to be able to, be in the right position. That's awesome. So so how long does it typically take? So if I'm an expectant mom and I want to get adjusted and kind of just work with you and figure out, make sure I'm best prepared for labor, how many times would I come and see you? And then also, how long does it take? Like, how long is a typical session?
Yeah. So I'm going to say this is hugely variable depending on your provider and what their process is, and also your body and what you come in for. But I'm going to give you an idea of what we do in our office. So just so you have a little bit of a concept, but just know when you go to see a chiropractor, if it's not at our office, their process may look a little bit different. But typically, you have an initial appointment, and this is the exam appointment. So, this is the appointment that's a little bit longer. At our office, we spend about 45 minutes at that first appointment. We take a very thorough history. We want to know all about any previous birth experiences. We want to know about your current pregnancy. We want to know about your pain. And anything else that would be relevant, so that we ask quite a few questions then. And then we transition you to the exam part. So we're going to go through range of motion. We might check your gait. We might check your spinal movement in general. So we have an idea of how your body is functioning and moving. There's a lot of different assessment tools at our office. We also have a program called Posture Screens. We take pictures of your posture and then we analyze that so you can see, is your pelvis tilted forward? Are your ribs flaring? Is your head really far forward? But you might find in the office that you go and they use different parameters as far as their exam goes. And then at our office, we do treatment on that first visit. And our treatment is typically adjusting. So we'll do that Webster technique along with full spine adjusting. So we want to make sure everything is moving and aligned exactly the way we want it to be. And then we'll do some soft tissue, which is very supportive for the adjustment. And in our office, we also will go through some very small core and pelvic floor rehab type movements. So things that you can be doing at home to really prep your pelvis for birth and delivery, and also build some stability in so that you hold your adjustments for a little bit longer. So generally, we see people about once a week during pregnancy. That can go up or down really based on how well you're doing. If you're in a lot of pain, I'm probably seeing you more than once a week, at least in the beginning. If you're coming in for wellness and you're doing yoga and you're getting massages and acupuncture and your body's adapting really well, I might see you a little bit less than that. So that timing can vary quite a bit. Our regular adjustments really only take about 15 minutes, and they can vary up or down from that. The adjustment part itself is pretty quick, but if we're going to also do some soft tissue and some rehab, it might be closer to a 15-20 minute appointment.
Okay, perfect. Well, that's pretty quick actually after that initial appointment. Okay, so tell us a little bit about the moms, the new moms. So I imagine that you see all kinds of crazy, I mean, I guess with expected moms too, but new moms, they're like, okay, holy cow, I need some serious help. My body's completely different after I had this baby. So, what are some common concerns for new moms?
Yeah, so it's funny because a lot of moms plan for the prenatal part and the birth, but they don't necessarily plan for themselves postpartum. They might be planning for baby, but they're not thinking about, how my body is going to be impacted post birth. And so, upper back pain and tension is probably the number one thing that we see in a postpartum mom. You're holding your baby all day long, you're hunched over, you're looking down, that upper neck and shoulders gets really, really tight. And like you mentioned, your breasts get quite a bit bigger, especially if you're going to be breastfeeding and there's milk there. They're heavy to hold up. So we see a lot of patients for upper back pain. There's also quite a bit of pelvic issues that we can work with postpartum. It's not uncommon that your pelvis can be torqued or can be twisted. We sometimes see that the tailbone is bruised and there's some like discomfort in that area as well. You might also feel like heaviness, a lot of core weakness, a lot of pain in your inner thighs. So getting adjusted in general and making sure that everything is nice and aligned as that relaxin is starting to filter out of your system and your ligaments are starting to reharden can really set you up for success in the healing period. And we always, of course, at our office pair the adjusting with just a little bit of rehab as well. So we want you to be engaging your muscles, your core and your pelvic floor, kind of reteaching them how to work now that baby's not in your belly, as well as making sure that you're nice and aligned.
Got it. Okay. So I know that you do some rehab with getting those stomach muscles back together. So I was doing some research about it, and I know that it's like, okay, well, you could come and go to a chiropractor, and especially yours because it's for new moms, but you can do rehab to tighten those muscles back together. Is that true? And how does that work?
Yeah, absolutely. So, fun fact, in other countries, it is standard of care that you go through rehab postpartum. And here in the US, typically what happens is you get a check mark, you look good at 6 weeks, and you kind of get dismissed from there. So, a lot of people don't realize that they even have ab separation or that their pelvic floor issues can be healed. But in the US, we do have pelvic floor PTs. Physical therapy is a really great starting point to rehab yourself. At our office, we have a whole rehabilitation uh, part of our office. So your local chiropractor might also be able to help rehab that. But yes, separation during pregnancy is very common. It is even more common the more pregnancies that you have. And so that is caused by a lot of different things. It can be caused by baby being in a weird position. It can be caused by a weak core. It can be caused by a weak pelvis. It can be caused by lifting something too heavy when you're pregnant. So there's a lot of reasons why your separation might get pretty wide, but there's a lot of rehab that you can be doing to get that closed together. We have rehabbed someone that had a 4 finger separation before. That is like I can stick your fist or my fist in that separation, and she was able to bring it close almost to a 1 finger separation.
That is so
And
awesome. And how long does that take to go through that process?
yeah. So I always tell people 9 months in, 9 months out. So keep that in mind. Um, if you have separation of your core, depending on how wide it is and just generally what your lifestyle looks like, it will really dictate how long it takes to have your abs come together. We have a very specific program at our office that uses a machine that gives you motor stimulation and sensory input on your abs while you're going through rehab. So we have been able to cut rehab times like and make it 3 to 4 times faster. So it's not uncommon that a 2 finger separation, we can get that closed up in 8 weeks at twice a week. But if you're just going the regular physical therapy route, which is not a terrible route to go, 2 fingers is probably going to take you anywhere from 4 to 6 months if you're just doing exercises on your own. And there's also a lot of like online programs out there. A lot of moms choose to do those because they're super accessible and they can absolutely help you progress in closing up your abs. A little bit every day goes a really long ways, but give yourself a lot of grace, is what I would say to a new mom, because it does take a little while.
And I'm sure that, there's moms who can afford this option, but they're like, I'm going to get a tummy tuck. Like, forget it. I don't care about all that rehab. But if somebody has a four finger, that's pretty, I mean, significant given, the size of that. But do you think if I were a mom that came into your clinic, and I was like, oh, well, I have a 3 finger, and are you pretty confident that if I follow your routine, that it'll get that much better?
Yeah, I always tell people it's okay if you want to go the surgery route. That's totally okay. But you still don't have function of your core, even if you sew it together. So, what we are working on is getting your core to function, which is going to prevent pelvic floor issues, prevent back pain, help you feel more stable in general. So, even if the long term goal, you're like, I'm getting a mommy makeover, I don't think I need all of this rehab, I would still highly recommend surgery rehab and post surgery rehab. If you went in to get knee surgery, you'd have pre rehab and you'd have post rehab. And the same thing goes if you're going to have an abdominal surgery as well.
That's so interesting. You would think, and I've been talking to a lot of people in the last couple of months just who are, functional medicine or kind of different avenues of instead of being with a doctor all the time. But it's interesting that, if somebody did go and get a mommy makeover, that they wouldn't have somebody, the doctor, that would say, hey, by the way, you should do this for 3 months beforehand. And then post surgery do this for 3 6 months, whatever it might be, because those are completely two separate issues that you're actually dealing with.
Yeah. And it's funny, we have so diastasis surgery is typically considered cosmetic, which is really important for you guys to know if you're considering surgery. So it's typically not covered by insurance unless you have hernia repair. So what a lot of patients do is they go in for hernia repair and diastasis surgery. And those surgeons, at least in Austin, I've never heard of a patient being referred out by their surgeon for rehab, either before or after. I have had several patients find me afterwards and say, I got this surgery, but I'm still so weak, I feel like I'm not functioning. And so they'll come in and we'll do post rehab. But that's just because they on their own found us and they were like, I need some more help post surgery.
Gosh, I feel like from a business standpoint that you should go into these offices, especially, mommy makeover situations, given what your specialty is, and like partner up with them and be like, listen, this is just better overall for the patient.
Yeah, it is. It's on my to-do list, believe
Yeah,
me.
yeah.
Because it's
Well, and it's tricky. It's like things with me too. I'm like, okay, I got to write this thing to HR of this big company to have a presentation. And I'm like, okay, that takes a lot of planning and a lot of time.
yeah, but I agree, it's so needed, and I think a lot of women are going into these surgeries thinking like it's going to fix all my problems, and sometimes it fixes a lot of problems, but it doesn't fix all of your functionality, so you still have to get the muscles working to get full function back.
Yeah, definitely. Okay, so tell me your top 3 pieces of advice for an expectant mom.
I would tell an expecting mom, number one, start working on your body early rather than when your pain pops up. We find a lot of people will come in, second, third trimester because they're in a lot of pain. And it is much harder to balance the body out when it's been unbalanced for all of these months due to relaxin in your belly growing and things like that. So, start your body care early, whatever that looks like. For you, it might be chiro, it might be massage, it might be acupuncture. It doesn't really matter what it is, but get your team together, what you feel comfortable with, and make sure that you're taking care of your body. Um, Two, I would say, and we didn't chat about this yet, but baby learns how to regulate their stress based on how you regulate your stress. So if you cannot regulate your cortisol, if something big happens and your cortisol is out of control, then your baby learns that from you, and you're more likely to have an anxious child. And this is backed up by research. So anything that you can do during pregnancy to help regulate your nervous system, do those things. Meditation is great. Chiropractic also helps to regulate your nervous system and decrease your cortisol. Acupuncture is really great for that. But I think that's a really important piece of pregnancy that's not talked about a lot.
Yeah, I did not. I mean, you kind of think about it where you're like, okay, then whatever the stress might be, like let's say you're, whatever it might be when you're pregnant. And I never really thought about that. That is actually your child kind of picks those up and then that's who they are.
And we can thank our moms for those of us that are have anxiety, I guess. No, but it's not talked about a lot, and I think we need to talk about it more. We live in a fast-paced, stressful life typically, and learning how to take a breath, decrease our stress in general. And this doesn't mean that you have to have no stress. It's actually important for baby to feel you get stressed out, but then be able to bring your stress down. That's regulating your stress. So you're going to have stressful things, but you just need to be able to balance those stress hormones. And then the last thing I would say is educate yourself as much as possible. There's, especially for first time moms, there's so much that you just don't know the first time around. And there's so much information out there that sometimes it can be overwhelming. But the more informed you are, the more likely you are to have the birth that you want and to have the pregnancy that you want. So reach out to those providers outside of just your OB and your midwife. Talk to your chiro, talk to the acupuncturist, read books, take online classes, like really dig into as much as you feel comfortable with all the aspects of pregnancy. I think women feel a lot more empowered going into birth when they're really well educated on it.
Yeah, I definitely think so too. Or what are your thoughts on working with infants for chiropractic services? Do you work on infants? Do you recommend that? And then also with that, with kids in general?
Yeah, so I would say yes, absolutely. We specialize in working with peds, and the earliest patient I've ever seen was actually 8 hours old. So I saw a super fresh baby, super sweet. There's a couple of reasons why you should take your baby to the chiropractor. And I know it can be a little bit scary if you've been to a chiropractor, but just know a pediatric chiropractor is going to be very gentle. There's no high velocity adjusting, there's no cracks and pops. It's little tiny pressures in different areas to help with alignment. And so going through the birth process, it's a lot on mom's body, but it is just as much pressure and tension on baby's body. So it is very common that when baby comes out, they're holding a lot of tension in their muscles. They're holding a lot of tension in their stress system. And so we see babies come out nice and curled up, and they really struggle with movement in the first couple of months. So what we want to see after an adjustment is that all of their joints are moving well, especially the neck joint, which often gets strained during the birth process in general. And we're seeing lots of helmets from flat heads because baby can't turn their head both ways. So they're only looking one direction. And when they do that long enough, their heads are so soft that we end up with a flat head. So a lot of flat heads, I really believe, can be prevented with adjustments early on during a newborn's life. So yeah, just getting all of that birth tension out. And then if you choose to breastfeed and you're struggling with the latch, adjustments can really help loosen up the jaw and help baby to coordinate the tongue for the latching process. We work with a lot of babies who have ties, lip and tongue ties. And so with a lip and tongue tie, they have body tension. Those two just go hand in hand. So if we can get the jaw and the tongue and the neck nice and relaxed, they usually can latch on a little bit deeper and it's not as chompy either.
That's so interesting. I would have never ever thought, lactation with what you do and how those all go together, but of course they do. It's like so obvious.
Yeah, and like you said, you're a chiropractic virgin. I feel like pediatric chiropractic, it wasn't really a thing even when I was a kid. It's very, very much a newer emerging specialty within chiropractic. So people are just learning and hearing about it, but it can be so life changing for those moms and babies that are struggling with tension, with stress. A lot of colicky babies also come in because they're just so uncomfortable, and chiropractic can really release a lot of tension to help with that.
I love that. So at what and then also not just infants, but like as kids grow up, just kind of in general for the moms that have older kids, how can chiropractic sort of help them with their kiddos, whether it's stress, because that's a big thing for any kid, I think, and just sort of their body alignment.
Yeah, I think that we're seeing more and more in older kids this kind of text neck posture where kiddos are spending a lot more time on technology and they're a lot more hunched over. They are experiencing a lot more, at least in my experience, pain, and they're at higher risk for injuries. I'm seeing a lot more injuries even in the last 5 years than we saw like before COVID. And so getting adjusted early on can help with natural spinal curve development. So when we come out of the womb, we're not born with our natural curves. They develop over time. And so if they don't develop correctly back or kyphosis where there's too much curve in the mid back, so a lot of those things can be prevented if you're getting adjusted very early. And I'm talking about like 2 to 8 is a really foundational time for curve development. And then for general body functioning, it's helpful to get your kiddo adjusted regularly. I find that the kiddos that are adjusted regularly seem to be a bit healthy. They bounce back more quickly when they're sick. Adjustments boost that immune cell count, so it can really help kiddos learn to recover from sickness more quickly. It can help with nervous system regulation. Really, anything that our body needs to regulate, adjustments can help with. And so as a chiropractor, we're really looking at bodies from a wellness perspective. It's not, I have back pain or I'm sick, let's go to the chiropractor. It's more of, I'm doing okay, but what can I do to be optimal? What can I do to be better functioning, higher functioning? And kiddos, really the foundation you build for their health and their spine, that goes with them for the rest of their life. So you might be preventing chronic low back pain in your kiddo or chronic headaches or migraines if you can just get their body regulated and developed correctly in the first place.
Yep.
Yep.
And how old are the kiddos that you see at your clinic?
How old?
Yeah.
Is that what
Like
you
up
said?
to what age?
Yeah, we see all ages. So 0 to 18, all the way up to the top. I'll say that the older kids we typically will see for more sports and posture. The younger kids we often see for more functional things like um, colic, constipation, stress, falls, developmental issues like crawling weird or torticollis. But we recommend a wellness schedule for a kiddo is once a month. So if your kid has no problems, no issues, if they're coming in once a month, then we can really catch and prevent a lot of things from developing later on because we're seeing them so regularly.
Wow, that's awesome. And then out of curiosity, just being a mom with 3 kids, insurance. Does insurance cover chiropractic services?
Yeah, so some insurance will, most insurance won't. And especially in kids, it can be very challenging to get coverage with insurance because what insurance wants to cover is pain. And your baby who's not latching is not saying, oh, I have back pain. So coverage can get really tough. I'll also say because insurance reimbursements are very low, it's even more difficult to find a specialist chiropractor, like a pediatric specialist, that bills your insurance directly. So at our office, we give out super bills. You can submit that to your insurance and they might reimburse you for part of the care. That's a pretty common model in pediatric chiropractic offices is that you're paying up front. And then if you want to submit, you can submit and you work directly with your insurance for any sort of coverage.
Got it. Got it. Okay. Yeah. I just feel like the healthcare system in that way is just so backwards, where it's like, why don't we prevent? Like, why aren't we preventing these things? All we're doing is treating these things. I've recently listened to so many podcasts on the topic. It's like, how are we? I mean, it's just all about money, I guess.
Yeah, I know, but we're pretty sick here in the US, so something's not working. Something got to change at some point.
I know. It's so true. Well, Catherine, thank you so much for answering all these questions. It has been so great. If you want to sign off with your information, your website, how people can reach you, that would be awesome.
Yeah, absolutely. Thank you so much for having me. I always love having these chats and getting to talk about what I do every day. Yeah, you can find me at our website. It's birth-co.com. You're also welcome to reach out to me personally. My email is Dr. Katherine, DrKatherine at birth-co.com.
Awesome. Well, thank you, Catherine, and we'll talk to you soon.